Welcome to Weekly with Midwife, the show where we try to answer all your questions about childbirth and delivery. Today we have two moms with us and we're going to discuss the 13th week ultrasound and possible defects that can be assessed. Ultrasound screening is used as an assessing method during pregnancy, and it can be done either 13th or 20th week for the first time. It's generally used to assess gestational age, but it can also be used to see other things, such as, for example, structural abnormalities like neural tube defects. In the Netherlands, the 13th week ultrasound is not covered by insurance because you can choose if you want to do it or no, and you have to pay it yourself. The cost is normally 165 euros. However, when you find an increased risk for example, neural tube defects, then you can do further testings, for example, a combination of lab values through blood test and ultrasound. If the tests are abnormal, then of course there will be further investigation. On the other hand, the 20th week ultrasound is covered by insurance and is much more detailed for abnormalities and structural problems. It's completely safe for the baby and the mother. However, you should know that the outcome can be either positive or negative, and you have to know what you expect from that and how to react to it. Today we're gonna see both sides of the story. So a mom who decided to choose to not do the ultrasound, and a mom who decided to do both of them. So now let's get to know our two moms. First of all, Ms. Van Dijk, can you please introduce yourself and tell us something about your risk factors during your last pregnancies?
Yes, my name is Ms. Van Dijk. I live on Urk. I'm 34 years old and I recently got my 5th child. I heard that diabetes type 2 and obesity could be a risk factor for spina bifida, and this turned out to be correct because my 5th child was born with this.
Thank you. Now, Ms. De Vries, would you please introduce yourself and also tell us something about your risk factor during pregnancy?
My name is Ms. De Vries, I'm 29, from Amsterdam. I had my first child recently, and as I am epileptic, I take anticonvulsants. And this medication is also a risk factor for neural tube defects. That's why I decided to have the ultrasound at 13 weeks, because I wanted to know if my child has a serious disease or defect, and also wanted to take in consideration to have an abortion.
Yes, indeed, the risk for having a baby with a neural tube defect increases when you take anticonvulsants because they interfere with the work of folic acid. And normally you take folic acid when you are trying to have a child or in the first month as well of pregnancy, 0.4 milligrams. But if you take this medication, then 0.6 milligrams. Did you know that?
Well, I didn't know, but the child was unplanned, so I didn't take it. That's why I had the ultrasound, because I was really scared. And it turned out that my baby had a neural tube defect. And for me it was really good to know in advance, because I could prepare, the doctors could prepare, and everything went smoothly afterwards.
Which neural tube defect did your baby have?
It was a spina bifida.
Okay, thank you. And what about you? Did you undergo the ultrasound due to your obesity? Maybe you were scared as well?
No, I didn't undergo the ultrasound because I'm a Christian at heart and it's very important in my family. So we believed that the pregnancy was in God's hand. Yeah. And it went well, and my baby is a child of God, so we accept him just the way he is.
Okay, so Ms. Van Dijk, how was your pregnancy without the use of ultrasound as a screening method?
My pregnancy was great because I just had a normal pregnancy and we were all very happy that another child was coming. But the only hard thing was the birth, because of course we weren't expecting this, and it needed some management, but in the end it worked out.
Okay, thank you very much. Mr. Friesen, how did your pregnancy and preparation and also the delivery go with the use of ultrasound screening method?
Well, after the screening, we did some further tests to confirm the diagnosis. And due to the fact that I knew so early, I really was in control. I had many options. We also discussed with the doctor to have intrauterine surgery, which turned out not to be necessary, luckily. Yeah, but all in all, for me, it was really good to know in advance.
Okay, thank you very much. So today we discussed the possibility of having a 30th and 20th week ultrasound as a screening method during pregnancy. And well, we've seen two completely different approaches, and obviously there is no right or wrong option, but it's just very important to discuss the possibility with your family and to be aware of the benefits of the screening and also of the consequences. So thank you very much for having been here, and next week we're going to discuss the topic of teen pregnancy, same time, same channel, so I hope to see you all there. And thank you very much from Weekly with Midwives.